Settlers and outsiders have a history of bringing illness and violence into Indigenous communities. In many Indigenous cultures, the import of infectious and parasitic diseases are entwined with first contact with settlers. In fact, smallpox, measles, and other imported diseases eliminated up to 80% of native populations in the Americas following European contact. The COVID-19 pandemic has created a crisis that highlights the greater vulnerability of Indigenous peoples' social, political, economic, and environmental health. The negative impacts that COVID has on people, their relationships, community, and environment do not affect everyone in the same way. For Indigenous communities, protection can come from staying separated from people from outside of their community. In order to protect community members, many Indigenous groups have erected checkpoints and blockades to prevent the spread of COVID-19 to their community. However, the blockades are not always honored by outsiders, and in this case, the police are telling Indigenous people to remove the blockade from their own land. Industry can also bring disease and violence to Indigenous lands and peoples, so First Nations and chiefs from around Canada have requested this year that sites which import workers suspend operations. Some of these requests from First Nations to have operations suspended or travel restrictions enacted have not been honored, so it has become Indigenous people's responsibility to protect their communities through blockades and checkpoints. Creating policies which respect Indigenous people's rights to protect their lands and peoples during times of pandemic would help slow down the spread of future pandemics in these same regions. Moving to the United States, 31% of New Mexicans who have contracted COVID-19 are Native Americans from the Navajo Nation. The Navajo Nation has a higher per capita positive test rate than most U.S. states. To protect the community and especially community elders, the Navajo Department of Health requires that everyone stay home between 8 p.m. and 5 a.m. To make sure people are staying home during these hours, Navajo police officers have put up roadblocks to make sure people are not going out. COVID-19 has drawn attention to the lack of money from the government for healthcare in the Navajo Nation. In the Amazon, many Indigenous peoples live far away from outsiders. This means that their bodies haven't seen as many viruses, and so often they do not have the same defenses to new viruses as someone from outside may have. In the region of Amazonas, where there are many Indigenous peoples, there is a lack of good health care available because of a lack of spending on things like buildings, supplies, and staff. Because of this lack of health care, Indigenous people have requested isolation. And in this case, community members came up with a way to protect themselves by using banana leaves as masks. In order to protect Indigenous peoples around the world, we need to abide by community requests for isolation, as well as abide by official public health orders.